All right, y'all, let's get into it. Welcome to episode 3 of Fertility Goals, the podcast. Thanks so much for everybody who's been listening, sharing these episodes, liking the content, subscribing to the channel. I truly appreciate it. So today we are going to go into a major topic: financing fertility treatment and insurance, how it works. This honestly, again, could be like 8 different episodes because there's so many different ways to tackle financing fertility treatments. And so today I want to talk about insurance. Because as you all know, and if you've listened to episode 1 and 2, my husband and I will be going through fertility treatments, or at least getting evaluated. And so we've had quite a few questions that we've had, and they've been answered. And so we're just trying to share this information with you all. And so let's get into it. I also want to share about how much infertility treatment can cost. It can vary widely, but overall, for one IVF cycle from start to finish, which includes the medication stimulation and the actual egg retrieval, anesthesia for this process, embryo development, and final embryo transfer, you're looking at around $25,000. For intrauterine insemination, it depends. You know, there are certain midwives and different practices that do intrauterine insemination. So often those can range between like $1,500 or $5,000 or $6,000 a cycle. Again, you also have to consider medication, the size of the practice, how available people are, and the robustness of their staff. So there's all these different factors that come into play as you consider, what the pricing will be for certain treatments. Infertility insurance is actually a state mandate in about 19 states in the United States. So for all my US listeners, it all depends on where you live. Unfortunately, zip code actually really matters on whether or not health insurance will actually cover your fertility treatment. I'll give you of what states are covered and which are not. I'm headed over to resolve.org, and they give a really great and comprehensive list of states and what their coverage is. So let's go through Connecticut, because I live there. And so it gives you their definition of infertility. It looks like people get 4 cycles of ovulation induction, and then also at least 3 cycles of insemination. There's various coverage for IVF. And look at that caveat: it does not require religious organizations to offer coverage. But it seems pretty comprehensive. And what I thought was very interesting is that the treatment needs to be at a facility that is a part of the American Society. For my gals and guys in the UK, or Europe in general, or over in Canada, you all have a socialist healthcare system. And so even that varies, though, in terms of how many fertility treatments you will get covered. But typically, they are going to be covered to some extent. And then also egg freezing, depending on the territory that you're in, it will be covered if you have a extenuating circumstance. So those who have, let's say they got diagnosed with cancer and they need chemotherapy, which is known to kill all of the eggs and render people infertile, they will often get coverage for egg freezing. But mainly for this episode, we will be talking about the US-based healthcare system and how lovely, but also how hard it can be for some people. Just to start off, being very transparent, this is an episode of privilege. My husband and I do have fertility treatments covered if we decide to go that route. And I just want to explain how it is and how it varies. And I would love for people to share it in the comments. So like this, share it. Please discuss in the comments how my plan might be actually similar or different than yours, so people can know and have knowledge and understand what their options can be. Let's start with who gets fertility treatment coverage and who does not. As I said, there are 19 states in the United States that have some sort of mandate for coverage. Connecticut, New York, Massachusetts, there are mandates that private insurance needs to cover certain rounds and certain scenarios of fertility treatment, versus there are other states that have mandates that you need to actually offer some sort of fertility treatment. So all of them have their flavor. All of them are so different. Thankfully, I live in Connecticut. My employers are in New York, which is also another state that covers it. But my husband, his employer is headquartered out of Connecticut. And so we are actually covered really well on both sides. However, if you are not in a state that has a mandate, sometimes your employer will decide or, be open to offering different types of buy-up plans. Buy-up plans are extra plans that you or your employer will contribute money to in order for them to cover certain fertility treatments. So fertility coverage, what does it entail? What does it not? It varies. So the main thing is, if you ever start a job or looking at certain state mandates to see what needs to be covered, always ask, what does it cover? So there's some that do diagnostic testing, and there are some that actually do the treatments. And then there's some that do both, that have very comprehensive plans. And so thankfully I have an insurance coverage that actually covers both. So what is diagnostic testing? That includes your lab work, all of the different scans that you might need to have to assess you or your partner for infertility, which is hysterosalpingograms, different ultrasounds or saline sonograms, those types of diagnostic testing. Sperm analysis, you can ask if it covers sperm analysis testing. And then we go into the actual treatment realm, which includes medications. So if you need to have some sort of ovarian stimulation, there's typically medications for that are ordered by your doctor. And those are typically used with intrauterine inseminations or IVF, which we've talked about, we've heard about, and all that. And so, again, all these insurance companies are so different. There are some that cover the diagnostic testing, and there are some that cover the treatments, and then there are some that cover both. So it's really important to understand what flavor of coverage you have. And one thing I want to note, when I say covered, it does not mean free. And I learned that. Not necessarily like the hard way, but it was funny when I was calling the insurance company. She was just real quick to say, and covered does not mean free, which you're broke. And so covered is typically what is covered with your deductible. So my deductible is about $500, and then there's all these different like co-insurance things. And so with the co-insurance and the deductible, out of pocket for diagnostic testing for everything, including the labs and all the ultrasounds and the extensive genetic testing that I need, we're actually be coming out of pocket around $800. And with that $800, we can use our flex spending account. So in some ways that money is already taken out, so it's not an additional expense than what we're used to. Health savings account, flexible savings account. Again, for those people in the United States, we have a different healthcare system than abroad, overseas, or other countries. And so HSAs or FSAs are accounts where we can put pre-tax dollars to pay for healthcare. And so there's different caps depending, where you're at. And so basically I think already committed to having at least like $3,000 throughout the 12 months of the year go towards my flex spending account anyways. So that's a blessing. So I literally, just like a credit card, swipe it at the doctor's or provider's office and we'll be all set. Initial consults are typically, from what I've seen and heard, between $300 and $400. But if you have your insurance, this is all bundled in together the initial consult along with the diagnostic testing. So when we consider our $800 covering the diagnostic testing and the consult, it ends up working out really well and saving us quite a bit of money. After that, for our medications and the actual treatment plan, there was another number that was given, but I can't remember it right now, but I think it was around $1,200 in terms of our out-of-pocket max based on the deductibles that I've already had. So with that, we actually get something called 3 smart cycles. And so I was looking up Progyny's website and looking at like my description of benefits. And so I was looking up my benefits with Progyny. They are the buy-up company that United Healthcare or my insurance company has used. And I'll talk more about buy-up programs. And so they provide 3 smart cycles. I'll look up their website and have a video playing, but 3 smart cycles are essentially credits that you can use towards treatment. So 1 smart cycle can actually be broken down to a couple things. So it goes by forts, the way they differentiate, the way that they break down smart cycles, it's divided by 4. So 1/4 of a smart cycle can be some sort of treatment or medication or recommendation. What does that mean? So for example, an intrauterine insemination is considered 1/4 of a smart cycle. And so since I have 3 smart cycles, right? So 3 times 4, if I wanted to, I would have about 12 intrauterine inseminations that would be covered. If I did egg freezing is considered 1/2 of a smart cycle, so 2/4. So I could use 1 smart cycle for 2 rounds of egg freezing, which is pretty awesome. But an entire IVF fresh cycle is actually considered 3/4 of a smart cycle. And that 1/4 I can use for freezing eggs or freezing embryos later on after I've used it. So with Progyny, I've so far had a pretty okay experience. It was a little confusing at first. So what I did was I looked up United Healthcare and all the providers that basically are contracted with United Healthcare. And so I was able to find providers who accepted United Healthcare. So I make an appointment, and they asked me for my United Healthcare number, and they asked me if I had a buy-up program, and I had no idea. I truly didn't. And so they said, it's okay. Their billing office at this fertility clinic is amazing. And so they called United and they found out that, yes, indeed, I have a buy-up. So it's not necessarily United Healthcare that's managing these smart cycles. It's Progyny. And so this is where it kind of got annoying and confusing. So I had to call Progyny to activate an account, and they would give me a number that I had to share with the fertility clinic. But in order for me to get the number, I had to be on the phone with Progyny for about like 35 minutes, giving them my information, giving them, what fertility clinic I ultimately decided with. And then they kind of did an orientation about the smart cycles. So overall, it was very informative, but I just wasn't expecting for it to take that long. It's not necessarily that long, but it's just very different than anything I've experienced with health insurance. And so with that, I was able to understand what the restrictions are. She was able to reiterate that covered does not mean free. So don't come calling them, getting an attitude. And then she also shared that these 3 smart cycles are a lifetime maximum. And so what does lifetime maximum mean? For as long as that I'm at my job using this insurance, I cannot go over 3 smart cycles. However, what I did learn is if I were to switch jobs and they also use Progyny, my 3 smart cycles or whatever the smart cycles would that they contracted or the state has mandated for that employer to provide me, it would actually start over. So that's also something to consider. If you're at a job now that has the benefits, definitely take advantage. See if you can either do a round of egg freezing or your IVF before you move on to the next position, because the benefits actually end the day that your coverage is set to end. And usually that's about 30 days after you leave a job. I want to talk about Progyny and what it is and what it is not. So Progyny is a fertility benefits management company. It is not necessarily an insurance company, even though it acts very similarly. And it mainly covers fertility treatments and diagnostic testing. And so they essentially have an agreement with United Healthcare to provide these services to members of our specific plan at my job. Progyny actually comes with your own patient advocate, or kind of like a nurse navigator. I'm still kind of learning about it, but when I had to sign up and do that 30-minute talk, I was then assigned to a patient navigator, and I was told that's who I'm going to be asking questions to if I ever have any issues. And they would also be working with the billing and finance department of whatever fertility clinic that I choose to go to. I wanted to give folks a look at actual benefits and to really break down these smart cycles. So as you can see, each of the treatments have their value of smart cycles. 3 out of 4 for just an IVF, fresh, using fresh embryos, and you can see the currency and the values for the other types of treatments. So the frozen embryo transfers as well too. And right there, you see it's smart cycles are like currency, and they all have a different value. And this also breaks down the deductible. And remember, covered does not mean free, right? And so this just really gives a really good breakdown of what their information is. All of the medications come from a Progyny pharmacy. And so I haven't gone through that piece yet. And then I just want to show the surrogacy benefit for my job. It's $10,000 for a fund, but you can use smart cycles on the treatments. And then again, this is mainly just a breakdown of what you can expect to pay, and it all varies person to person. Say you are not at a job or in a state or, in a position where your company actually offers or provides fertility coverage. Companies like Progyny, I believe there's Carrot and a few other ones that I'll list here, where you can actually do a buy-up where you pay additional money. So it's like an additional insurance coverage to get some of your fertility benefits covered. I think it'll probably be more. A lot of this information is not on their website, so I assume you would have to call and figure that out. With most health insurance companies that are employer provided, we are subsidizing it together. So my employer is paying a portion, and I have my monthly premiums and my co-pays and my co-insurance that I have agreed to pay or that I selected. And so overall, I would definitely recommend to call these companies to see what they have to offer. But mainly, this is where you can meet up with your HR and advocate for yourself, advocate for your colleagues, for them to possibly consider partnering with these buy-up companies or these fertility management companies to offer benefits to the employers. I always say, even if it's just diagnostic testing that you can get covered, and then over time you can build up to actually treatment, that is something is better than nothing. But overall, these things can get pricey, and there's not a lot of wiggle room in terms of getting the prices down, just because with a lot of these testing and material, and because with a lot of the testing that needs to be done, they require some very expensive machinery, and they also involve multiple different types of professionals to examine. So, for example, a sperm analysis typically needs an andrologist to help interpret it. So it's not just something that is a one-man show, is what I'm trying to say. So fertility in general is a rather expensive field of medicine that's practiced, but a lot of that has to do with the extensive and numerous amount of positions that are involved in fertility care, diagnostics, and treatments. All right, so I also wanted to share some questions that you can ask your HR managers or generalists as you are trying to advocate for either yourself or your colleagues to actually get fertility insurance covered. First, one thing that I realize is that often people don't realize that they have coverage. So the first question to ask is, do we have coverage for fertility or other benefits? Again, just because you might live in one of the states that doesn't have a mandate doesn't mean that you are not offered or may have coverage available to you. So if you work for different tech companies, I hear even Starbucks and Google and Microsoft have these automated benefits for fertility. Again, go back to your HR, read over your insurance paperwork, and double check to see if you have it covered or not. If not, if you do not have it, you can ask your HR generalist if they could either negotiate it with their current insurance provider who they have a contract with now, or you can ask them if they can then explore partnerships with different fertility benefits management companies or buy-up programs. So like I said, Progyny is one. That's the one that my insurance partners with. There's Kindbody, and you can see if there's actually Kindbody clinics in your area. So that might be a benefit. And then also Carrot is another one. Maven will sometimes be another company that offers fertility management benefits. They definitely do in the reproductive health postpartum space. So yeah, start looking up to see if there's other companies that your company can now partner with, and make sure that is included as something that you can sign up for during your benefits enrollment period. Ask your HR generalist if you guys can get a buy-up plan that includes an array of fertility treatments. Often people think that IVF is, where you should go and where you should start. That is amazing. That saves a lot of people a lot of money. However, IVF is not a treatment plan that everybody needs. And sometimes I have heard that some folks will end up being offered IVF because it actually ends up being a cheaper alternative than doing IUI or certain timed intercourse because of their insurance coverage. Also, ask your HR generalist or HR office if you all can have some flexibility in terms of in-network and out-of-network providers. Often doing the buy-up programs, you kind of get rid of a lot of those barriers. But for example, if you're in spaces that don't necessarily have a lot of fertility offices nearby, you might be limited in terms of what in-network and out-of-network providers you may be able to access. So seeing if there are ways that you can get additional reimbursements for out-of-network providers who can help you during this process is going to be really, really crucial. And lastly, you can also ask your HR generalist if they would like to have me come in and do a training and conversation about the importance of providing fertility benefits and how it actually helps with employee well-being. Often you have not because you ask not. So please do not be afraid to ask HR to add on these benefits for you and your colleagues, because you definitely won't regret it. And even just having it there offers a lot of people some peace of mind. And so there's so many studies out there that's showing that the monthly premiums or the different out-of-pocket costs for the entire company actually don't really increase that much when you add on these different benefits and mandates as well too. Fertility treatment is expensive, but not everybody's going to be using it. And so it is also important to understand that adding on these benefits don't necessarily harm the the larger population, but studies have shown that it does not. It is actually very affordable, and offering these benefits are actually improving and increasing retention. So I hope I explained the fertility benefits as clearly as possible. We are blessed and extremely thankful that we have Progyny and these smart cycles, and we are looking forward to seeing like how this pans out. So definitely look out for a part 2 of this episode so we can really tell you and show all the numbers and cents of what was paid out for this experience.